Hi, I'm Paula Yost, the author of Tumbleweeds, and today I want to talk to you about adverse childhood experiences, ACE scores. So, back in the 1990s, there was a brilliant doctor named Dr. Vincent Felitti, and he was actually conducting an obesity study. And what he found was that in the course of that study, he had clients who lost a tremendous amount of weight, like 100 pounds, but then they would automatically gain it all back. And he couldn't figure out what was going on. Why couldn't his clients keep the weight off? So he hired a team of social workers to start speaking with these people to try to figure out what was going on. And in the course of those interviews, they would ask them, when was your first childhood sexual experience? And they were horrified when the answers from adults were things like 4 years old, 6 years old, 7 years old. And they realized that there was a really, really strong connection between childhood trauma and overall health. This research was built upon over several decades, and essentially you can download the Adverse Childhood Experiences Test, which we will put in my comments, so that you can look at it and take it yourself. People who have a really high score, like 8 to 10, are at serious risk of developing long-term health-related problems, like diabetes and heart disease. So this is something that we see over and over and over again. Childhood trauma really does impact your long-term health. So many autoimmune diseases are deeply rooted in childhood trauma and your body keeping that score and holding it and it all being stuck in there. The reason that this is so important is just for us as humans to know this from a public health standpoint. If you are a victim of childhood abuse, then you need to really be doing all that you can to take care of your health and to really be getting early screenings and preventative care. But also, it's important from us from a political aspect. How much money would we save if we invested more money in our children so that we don't have a sick population as adults? ACE scores are incredibly important. And if you have a high one, it doesn't mean that you're broken. It doesn't mean that you're hopeless. It doesn't mean you're going to die at 57, but it does mean that we need to take some steps to help you take care of your overall health so that you can live a longer, healthier life. I'm Paula Yost, the author of Tumbleweeds, and I hope this was helpful. Thanks.